Dear our esteemed viewers, welcome to this week's community show. In this show, we talk about matters that relate and impact community and also that impact the country at large. And today, we are raising awareness on HIV and AIDS. On 1st of December, the world gathers and commemorates, celebrates, but also raises awareness on the endemic that HIV/AIDS is. In Uganda, it's approximated that about 1.6 million people are living with HIV. In the world over, it's estimated about 20, maybe 26 million, as people will tell us, as the people on this, the experts here will tell us. There have been steps made in Uganda alone. There have been steps in the world, in Africa, to lessen this number. And in Uganda, President Museveni set the target to be zero new infections by 2030. To help us further this conversation, I'm joined by people who work in this field on a daily basis, people who are more knowledgeable in this field, who work in their communities, who also are health professionals to help us substantiate the issue at hand. I'm joined by Prima, Niwampeire, a medical doctor, Samanya Ibrahim, who is also a social worker, and Faisal Katende, who is also a social worker. And we shall later be joined by another person. I'll ask the people I've introduced to further introduce themselves to our dear audience. Ibrahim, I'll begin with you.
I'm known by the name Samanya Ibrahim, and I do work with the Iganga network of young people living with HIV and AIDS as the team leader, and I'm a young person living with HIV.
My name is Prima Niwampeire. I am a medical doctor, currently working at National Referral Hospital, and I also serve as a Publicity and Publications Officer at Patient-Centered Care Movement. Thank you.
Dear Faisal, it's your turn to introduce yourself.
My name is Faisal. I work with young people who are living HIV. That is called UNIPA. And I do a lot of things using my social media platform to change my fellow young people living HIV, to make them to be confident. I do a lot in the different categories. As me, a person, I was born with HIV. I'm a guy, I don't like HIV to define me because I know myself. Because even I can do like other people, they do a lot of things. Yeah, I'm a guy known. I've done my work, I've done my name in the different category, in different capacity, in a good way. I'm proud about myself because I can stand and I speak. I don't fear anything or what they will say. No. Those are my words. Thank you very much.
Thank you. Thank you, Faisal. I'll begin with you, Doctor, to give us the situation of HIV and AIDS in Uganda. What is the situation, situation like, if you may, how many people live, with HIV, what are the prevalence rates, name it.
Thank you so much, Martin. Currently, we have statistics according to the 2021 UNAIDS report. They reported that 1.4 million people were living with HIV by 2021. And of this, we had initially from 2010 coming to 2021, we had a decline in the rates. However, the COVID-19 hit us and we went back up in terms of statistics. Some of the factors that were associated with the rise in the COVID-19 pandemic, we had different factors like the healthcare sector tried to, in bid to combat the COVID-19, there was like sort of a diversion of efforts, yes. Almost everything was diverted to COVID-19. We had reduction in the service delivery regarding other sections of the healthcare, people who are already on treatment or people who are new on treatment were sometimes unable to access the treatment. Maybe, you know, we had problems with transportation. Initially, before COVID-19, would have those drug refills, community drug refills, but now because people were unable to move, we had an increase. Then there was also an increase in key populations, the sex workers, people doing sex for money, yes, due to the economy, I guess. So those were some of the factors that were related to the increased rates in COVID-19. Thank you.
Yes, thank you, Doctor. And I want to, before we go to other people, we usually use the word HIV and AIDS, yeah? And then many people say HIV or AIDS or HIV/AIDS. Please help us understand if there is a distinction between those two.
Yes, Martin, there is a difference between HIV and AIDS. HIV is the infection itself, an acute infection, or I could still use HIV to talk about the virus, yeah? On the other hand, AIDS is, we use it to refer to advanced disease, or we can also say AIDS-related illnesses. So maybe it will make more sense if I say these words in full. HIV is a human immune-acquired deficiency virus. So you see that we can also use it for that, just to refer to the virus or to the acute infection. However, AIDS is acute immunodeficiency syndrome. So all those diseases that come in and are related to AIDS as the primary infection or the advanced stage of HIV are referred to as AIDS. Thank you.
Is it possible that a person can have HIV and not have AIDS? Or is it possible that a person, is it possible that a person can have HIV and not have AIDS?
Yes, it's very possible. All the people with, not all, okay, most of the people with acute illnesses, most of the people in stage 1 AIDS, maybe I didn't talk about the stages of the disease, have the infection, but they don't have the illness, they don't have AIDS. So it's possible.
Okay, thank you. Ibrahim, we would like to, you work in communities, I could maybe be right to say you're a social worker or you do social work in a sense. Please paint for us the situation as you perceive it in the country, but also in your community, the situation when it comes to HIV and AIDS, and consequently AIDS here.
Yes, I could like to thank Prima for the information. Currently, the country is standing at 1.46 million people living with HIV. And worldwide, we are standing at 39 39 million people living with HIV. And of this total, the highest rate is amongst 15 to 24 because of several vulnerability, such as high risk to sexual activities, substance use, then engaging in peer pressure groups. And this rate is most high among ladies because of the various vulnerability. Yeah, in my district, Iganga, it is not different from other districts because of the vulnerability of young people face. In Iganga, we are having over 3,000 young people living with HIV. Then of these, they have faced a lot of challenges, especially related to COVID-19 outbreak. Their drugs, we are stopping going to the hospitals to get the drugs because of the lockdown. And this enforced us as the organization and other stakeholders to come up with initiatives to enforce these young people remain on care. We delivered drugs to over 1,000 young people living with HIV in the district, both Iganga and outside Iganga. We made sure that all the Busoga region districts, we serve the young people living with HIV, together with the districts, CSOs, HIV advocates, and activists. Yeah, we have also faced a lot of challenges like stigma and discrimination. Since HIV was discovered in the world, people living with HIV have been discriminated daily based on homestead, schools, workplace. Then also amongst the young people living with HIV and the general population, there's self-stigma. These people think that I'm HIV positive, I can't do this, I can't do this. This limits them to expose whatever they feel like. Then another issue is about the confidentiality amongst the health workers. Many people come to the facilities requesting for information about these clients, but some health workers do not have confidentiality policies. They just give out information. Someone calls that, yes, Ibra, I am fine. Are you living with HIV? Then I ask him, how did you get information? I got this information from this facility, what. Then according to the HIV Prevention and Control Act, you are not supposed to give out my medical information without my consent. First, you have to give me a call that there's someone who likes to receive information about your HIV status. Could you allow? Then I say, if yes, if no. Then another issue is about traveling restrictions. Many young people wish to go to various countries for various purposes like education, this, but restriction amongst different countries, limiting them to expose these opportunities. Like for me, I have traveled, but some young people do not have that opportunity to travel out. That is all I have.
Yes, thank you for that. Maybe to be specific, are there specific countries that require someone to show their HIV status to travel?
Yeah, most likely in Arab countries. If you are going for either home visit to visit someone, you have to declare your HIV status. And this enforces many young people or people living with HIV to put their drugs in different luggages, so that when he or she reaches that site, he or she has some drugs on him where the other drugs are left. Like if you have ever traveled, the plane that carries you is not the plane that carries the luggage. Your luggage might be misplaced for some days or some hours, and you delay to take the drugs. That is all.
Yeah, thank you. I mean, that's quite odd, and it's in my opinion, a bit discriminatory and not called for people to declare HIV, their HIV status. HIV is not a communicable disease. It's not that it spreads through the air like many other communicable diseases, that are easily transmitted. So honestly, it's sort of, it stigmatizes people further. And if being HIV positive or negative plays a role in one being given a visa, that's a repugnant practice and should be honestly condemned. But also, we would encourage people who travel and who have different, who suffer from different diseases, who have different situations where they have to have medicine. Please always move with your medicine in the hand luggage. I think it's many times it's allowed in the hand luggage. Many things usually happen when you travel and you've put your essentials, such as medicine, in the luggage that goes with cargo. That's, at times it can even take long to recover. At times that luggage is misplaced, and then some countries do not actually have these drugs. You may suffer that. So please, when you're traveling, always make sure that you move with your medical prescriptions in your hand luggage. Katende, I want to come to you. Please help us understand the situation, how the situation is like in your districts, prevalence, rates, the kind of work you also do. You can take us through that journey of what you do and how you are raising awareness and the situation like within your how the situation is like within your community.
For this platform, I appreciate to be with me. The things I do in my community. The first beginning, I was just dealing with the media people, Facebook, Twitter, TikTok. I've did a lot to change my community. Why? Because sometimes I take myself to be something like a wase. I sit in the different people category, different legs. My target, I'm not targeting only people who are living HIV. I'm targeting both people. Because when we stand together, we can end HIV by 2030. But when you think it's only people who are living HIV, there are people who need to end HIV, stigma, what and what. These are things cannot work. Because we need to work together as a family. That's all I tell my community. That's all I tell my fellow people on social media. Because I have a lot of people follow me who like me a lot. They take my word. And then other things. In the COVID season, I did a lot.
I want to come to you, Prima. Prima, it's not like Ibrahim has said and Faisal has said, there are many stereotypes. There are many, there's stigmatization, there's stigma when it comes to people living with HIV. I want you to tell us some of these stigmas that you as a health worker and a publication or a public relations person has heard, or you've interacted with in this area of work. What are some of these myths and how can we dispel them?
Thank you, Martin. I think I'm a very young doctor. I'm a very young doctor. I joined the field, it's now a year. So I want to say that in my time of service, especially among healthcare workers, I don't think we still have stigma, as I see it with some other diseases, from the side of the healthcare workers. Yes. For example, let me give this example. You find that if we have a case on the ward and it's an Ebola suspect, everyone is skeptical about who is going to go there, give the drugs, even before you confirm, yes. As opposed to HIV, we have, if we have someone who has HIV on the ward, maybe it's not an HIV ward or something, we don't still have that kind of stigma. Maybe it was there in the beginning when the awareness was not as much, or before all these fights against stigma had come up. But currently, especially from our side, the healthcare workers, I want to say that there is no much stigma. However, we just notify other healthcare workers, or just notify ourselves within us that, you know, that one is not safe, so that in case you get in contact with the body fluids of the person, or maybe you're doing a surgery and you prick yourself, you know whether to start PEP or not, just for safety reasons. Yes. From the community, maybe Ibrahim or Faisal will tell us, but from the healthcare workspace, there is no much stigma with the HIV patients, from the healthcare workers to the patients themselves. Thank you.
Yeah, thank you. Yeah, stigma and discrimination in this area has greatly, I must say, reduced. And in Uganda, with programs such as PSA, programs of the AIDS Support Organization, programs from UNAIDS, Ministry of Health, name it. They have increased awareness on this issue, but also helped reduce on stigma, discrimination, and very profoundly, the HIV Prevention and Control Act of, you could, correct me on the year, but that act honestly helped curb what existed before, the discrimination and systematic discrimination that existed, in employment places, in schools, in even government institutions, also to do with the data protection of people living with HIV, their dignity, and all that. I think we've gone far. I mean, we grew up associating, for example, body size to HIV, but those myths and stereotypes have since been dispelled and demystified. But I know many still exist. And Ibrahim, I want, from your perspective, what are these myths that continue to persist to this very day? You have perhaps had or interacted with such myths, stereotypes in your day-to-day work. What are some of those that continue to persist in your community?
Okay, we do still have myths and misconceptions around HIV and AIDS in the community. Many young people think that when a mosquito bites you, you'll get HIV. Many think that after using the same plates, spoons, forks this person living with HIV has taken food with, I'll get HIV. Then many young people think that, well, if I do this, I would get HIV. And that is still a lot of, if we don't empower these young people and people in the community with information, we won't end HIV. To be point blank, we do have information, but people do not want to use the avenues to access this information. We have libraries, we have the internet, but if you ask a young person, have you ever visited the internet to search about HIV? Point blank, she'll tell you no. She'll just go on TikTok, WhatsApp, Facebook, but we do have various articles, journals, blogs about HIV and various diseases researched by different authors, as activists, advocates, CSOs, doctors, whoever everyone has ideas. Then another issue was about many people were forced to disclose their HIV status during the lockdown. If you do remember when the president said, if you want to go somewhere, you have to get the permission from the LC1, the RDC, police blocks were all over the country. If you reach this point, you have to take care of yourself. That, hey, I'm going to get these drugs, which drugs you pull out your book, your teen. And this forced many young people and people living with HIV to feel discriminated, to not retain into care, to miss out appointments. And since the country withdrew all efforts from HIV to COVID, many people living with viral diseases like hepatitis B, cancer, diabetes were left to suffer. Since the government took all the efforts to COVID, and yet we had a pandemic within a pandemic. Because COVID came, whereas HIV was still in existence. We could use the same efforts we used to work on HIV, the same could be used on COVID, but they took all the efforts on the side of COVID. And this made many people living with HIV and the general population to be at a risk. Because this is the incidence where I rates increased. People are not working. And like in the case of where I stay in Usoga, people were not working, and you know, the husband is around, he has been away for over months. This forced a lot of people to engage in sexual activities, hence increasing the transmission rates. And this also forced many gender-based violence. Since HIV and gender-based violence are like sister and brother, if someone is sexually abused, this increases the rate he or she will get HIV.
Thank you for that. We also recognize that there are many structural issues and legal issues that continue to propel discrimination and also stigmatization. For example, in the Act, there is still an issue. They penalize. They penalize people who have HIV. There is sort of like penalty of people who have HIV, who live with HIV and have consensual sex with people who are not necessarily HIV positive, and then there is, sort of transmission. The Act still penalizes that, and we think that is regressive. It's regressive. That is further to marginalized and already marginalized group of people, and it's unfair. There are also a number of things that we think are not right, even within the Act. Also some where it's required, to disclose and all that. Some aspects where it is required to disclose also goes against the spirit of fighting this. But also importantly is that there are other groups that continue within this spectrum of prevention of HIV and control. There are groups that are still at high risk, among them key population, people who engage in sex work, people who are in prisons, people who engage in, mainly men who have sex with fellow men. Those are still communities that further marginalized in this, because many times they cannot reveal this information when they go to health, workers or facilities, because of fear of discrimination, but fear of denial of access, fear of denial of access to medical facilities. And I want to come to Prima. How do these further marginalized groups, how are they handled when they come to health facilities? But also, a word from you to encourage such people to further seek, to know their status. How can we help in bridging that gap of key population, and encouraging everyone to know their HIV status, and also give reassurance that key population are vital in this fight against HIV?
Thank you so much, Martin. Like you said, we can't say we are winning this fight against HIV if we ignore the key populations. So first question that you asked, discrimination, or if they are treated different at the facilities when they come in, or don't we feel pity for them? No, that's not true. You test HIV positive, everyone is started on medication, regardless of how they acquired it. The services are the same. Probably the pity or no pity can be at personal basis, varying from healthcare worker to healthcare worker. For example, if I'm a healthcare worker and maybe I contracted HIV through, maybe when I was treating someone, or I got a blood splash during a surgery, well, there will be that personal, that personalized kind of pity that you get maybe from a healthcare worker, but it's not a generalized thing. It's on a personal basis. So in that way, usually when we get such people, key populations, we're even very receptive. We are very happy that they've been able to come up and seek for care, because most of the challenge that we are still having is that people have a perception of, oh, if I go to the facility and I got HIV through, maybe because I exposed myself, it's like my fault. So maybe people that the healthcare workers won't handle me the same way they'll handle other people. That is a misconception that we are still having. So when we get such people who come in, regardless of how they acquire the HIV, regardless of what they do, we are very happy, and we want to use these people to reach out to the populations that they live in. For example, if you're a sex worker, we want to use you to reach out to other sex workers to seek for healthcare. Yeah, you're looked at as a hero in that sector, because most of them won't come to the health facility. Yeah, and a message to them is that feel free. There is confidentiality, we take your consent, we do counseling before we do all this testing and the linkage to care. Yes, and just like I said at the beginning, before we win off these key populations, we are not going anywhere in the fight with HIV. Thank you.
Yes, thank you. Thank you for that. I mean, it's true. And statistics have shown that 25% of people living with HIV in Uganda, 25% are key population. So it's important, that we give also premise to that. Ibrahim, I want you now to help give, give those awareness kind of remarks where you are perhaps encouraging people, telling them how they can, one, know their HIV status, and two, how they can how people can seek help, assistance, psychological, and also, kind of physical access to facilities. Please help us understand how easy it is to know one's status and what is the importance of a person knowing their status, and where people can access these facilities that test, these facilities that offer support, name it. Ibrahim, that question goes to you.
Many key corporations face a lot of challenges in accessing health services and information at different health facilities. For instance, if a doctor or a nurse knows that this is a man who has sex with a man, this is a trans, this is a sexual worker, this is a lesbian, there is that attitude he or she has towards such people, that how can a female woman have sex with a female woman, yet God created us to have sex with a man? Then this person will question this person, and this person will feel stigmatized, and he or she has a right to move out of the room and refuse the services provided. We cannot end HIV without bring these people on board, because the HIV prevalence rates are high among the key populations. And also young people living with HIV are key population because of the infections they get. Like a person, I can be having HIV-1, another HIV-1, subset M, yet another person has HIV-1P. When we have sex with this person, we interchange the strains of HIV. And this also makes people living with HIV to be KPs. That's why all people are supposed to be meaningfully involved or meaningfully involved or participated in the design of every activity, the HIV response at the beginning until the evaluation of the health services. But some people just bring these people at the end of the evaluation process, that we carried out this activity for 6 years, but we are soon closing. And this is when they bring these people on board. But they never brought them at the budgeting, at the introduction, and in the middle, but they bring them at the end so that they be there to evaluate. You are evaluating something you did not know how it started. Then, I remember you were asking about the HIV Prevention Control Act was established. It was established in 2014, and it has many subsections that bring out the stigma and discrimination, as well as it has sections that protect these people. For instance, it has a section where a person living with HIV, he or she transmits the disease. Even though she has not slept with this person, but has that intention of sleeping with this person without disclosing, he or she may be imprisoned, fined, or do both punishments according to the act. And this person is supposed to disclose his status to this person or a medical health worker. But remember, disclosure is a personal issue, and disclosure takes a lot of time. You cannot be diagnosed with HIV today and say, tomorrow I'm going to disclose. It takes a lot of time and process. From day one, we have people who have lived with HIV for over 10 years, but they have not disclosed. And someone has lived with HIV for 2 years and he or she has disclosed. That's why disclosure is a personal issue. But there's some cases where a person living with HIV is supposed to disclose for the safety of his life as well as those people interacting with him. For instance, if you are going to have a surgery, you may disclose your HIV status to a medical health worker that for yourself and myself, I do have HIV. Then on the side of the mothers who are going to give birth, when she's pregnant and she's soon approaching giving birth, she has to disclose to the health worker, the tender, that I'm HIV positive, but I want my kid to be safe. So that this kid is put on an enveloping slip as soon as possible. But if she doesn't disclose, this baby may not be put on a enveloping slip, and this also increases the transmission rates in the country. That is it.
Yes, thank you very much. And that also takes us to a very important question here. But before we move, it's here to talk about this act. It's important that government reconsiders this act. We cannot have people living with HIV looked at as weapons or looked at as criminals already, you know, because of how they are engaging sexually. It's abhorrent. We cannot criminalize, you know, living with HIV or one's HIV status, because it's also true that in the Penal Code Act, people who are living with HIV and perhaps have engaged in another sexual-related offense receive higher penalties, you know, because of the mere fact that they're living with HIV. So the law, in a way, also looks at people with HIV as already criminally convicted or charged before they even consider other things, because one's HIV status is someone being HIV positive is actually an aggravating factor when someone is, for example, going to be convicted of rape or defilement or any other sexual-related offense. That is already to discriminate, and that is already to criminalize an already marginalized group, and such laws are archaic and should be outlawed. Having said that, let us go into the basics. This is something many times we do not consider or look at when you're having these discussions, because, I mean, society has progressed and we've moved forward in this fight. But when should someone go for HIV testing? Well, it's true that we should regularly go, but in case someone has not gone also, what are those moments when your health essentially determines that, you know, you're like, you know what, let me go for testing? To put it bluntly, and forgive my naivety, but many people out there could also think of it this way. What are the signs and symptoms that would show that, you know what, I could be having the virus? I will begin with you, Prima.
Thank you so much, Martin. I came across a few guidelines from CDC that recommendation, everything.
CDC is for our audience, CDC is Center for Disease Control. Is it the Africa or the United States?
Pardon?
I was, you know, for purposes of our audience, I was telling them the full meaning of CDC, Center for Disease Control. But there are two. There is an African one and there is the one of the United States. So which one do you mean?
That was for Africa.
Okay.
CDC Africa. So everything left constant. You haven't had, you have nothing to probably make you suspect. You haven't engaged in sexual activity with anyone that you don't know. They recommended once a year. Everyone should have an HIV test done every once a year. However, those other circumstances, maybe you've shared needles, you go for an HIV test. You've had sexual intercourse with someone whose status that you don't know, you go for an HIV test. You've had more than one sexual partners, go for an HIV test. Any form of exposure, yeah, to HIV, you're supposed to do an HIV test. However, my recommendation, now from the medical perspective and the pathogenesis of the disease, is that after exposure, you need to do this after 2 weeks also, owing to the latency phase of the infection. What I mean by this is that the strips that we use may not be able to recognize infection at maybe at an early stage of like you've had exposure today and you're testing tomorrow, because what they test for are the antibodies. So if you do it in a space of 1 day, the antibodies, it's very unlikely that the antibodies have formed. So if you've had exposure, the best thing is to start PEP immediately. PEP, for the audience, is post-exposure prophylaxis. You're on this medication that is preventing your body from getting this, you've been exposed, but this medication is helping you not to get the infection, yes? So you start PEP in that 1 month. Still, that when you go for PEP, they'll give you the guidelines on when to come back for testing and all that. Yes, I don't know if I've answered all the questions that you asked.
Yes, you've actually answered well. And perhaps if you could also add on the signs and symptoms. Are there signs and symptoms that a person has HIV? Maybe they have been tested and they, like they go on their normal activities. Is there a point where, like how you have malaria and you feel, oh my goodness, I think I have a headache here, I have a fever here. Is that the same with when a person has, been exposed to the virus, to the HIV?
Yes, there are signs and symptoms. Unfortunately, the early signs and symptoms, are very unspecific. Like I said, HIV has stages. So stage 1 of the infection, 1 month with the infection or 2 weeks, the signs and symptoms are just general body weakness and maybe unspecified cough or fevers. From maybe when a medical personnel examines you, we have these things called lymph nodes. They can feel like sort of swelling and pain of those lymph nodes. They're in different parts of the body. So many other infections, viral infections, present as such, Many other viral infections. When you have flu, you have a flu, you have a cough, you might have lymph nodes, but then you also have general body weakness. So like I said, that is very unfortunate because they are very unspecific. And when you've had exposure and you're conscious about this, you know that I had exposure. Somehow, it's the work of the brain. Somehow you will feel generally weak. So you don't know whether it's a symptom of HIV or it's just something about your mind that is giving you this. Well, I'm speaking this from experience because I have had exposure from a patient. And to tell you the truth, the first few weeks until I did my HIV test after a month were not nice. Every day I would wake up with a symptom. Every day I would wake up feeling sort of a symptom. But I have to say that The symptoms are there, but they're unspecific. The safest mode is start PEP.
Okay.
Yes, start PEP and test.
Yes. Yeah, thank you. Honestly, thank you for that, because I agree many people have an HIV scare all the time. And people who are actually mainly sexually active, I must say, always have HIV scares. And I mean, even when they have one partner, in a way, a person could somehow feel, the scare, or you're like, oh my goodness, I'm suffering from this, or I feel like this, or maybe, but the safest way is to test, honestly. But also if someone is sure that they have had exposure, is to test, is to start on post-exposure prophylaxis. I don't know if I've pronounced it right, but yeah, PEP. And also there's PrEP, maybe Ibrahim can tell us what PrEP is. Oh, he has gone off, but yes, Prima, what about PrEP? Possible that people can also, what is PrEP anyway?
PrEP is a pre-exposure prophylaxis. Yeah, you anticipate exposure. I don't know how they do it, and you take it. It is taken a month prior to the exposure. Because it's a new thing, yeah, there is not so much information about it. However, I've heard of the injectable, yes, that they take a month prior to the exposure. It is hard, in my opinion, considering that you don't know when you're going to get exposed. Exposure in most cases is like an accidental happening. Yeah. So, well, I can't say much about how you're supposed to anticipate exposure, but yeah, that is PrEP.
Thank you very much. Ibrahim, do you know something about PrEP that you could share? Ibrahim, over to you.
Okay. Like Prima has said a lot about the signs and symptoms. What she has said is what I do have, but many people do not experience some signs, whereas others do. Many people are living in the community with HIV without showing any sign. Some have lived with HIV for over 20 years, but they have not shown any sign. But someone can live with HIV for 2 weeks and signs show. That's why the uniqueness of the people makes them others to show, others not show the signs. But since there are some instances where someone is supposed to go for HIV testing, like Noma said, you cannot be exposed and you not go for an HIV testing services. You cannot sleep with someone you don't know that. Like for us, who like going out clubbing, and you say that I am in a month. Why can't I? My network is not stable. That is it. But we right now we have, like the government just approved the vaginal ring, where this lady has to put this ring in her vagina for 28 days. This ring has a chemical it releases, but it's for the negative people. When this person has HIV, has sex, this chemical.
Okay, we seem to have an issue with Ibrahim, but when his network gets stable, I think that's a good point for him to substantiate further. But I must say, like all of them are saying, it's very important that the testing is done, but also there is the options of PEP, that is when you've been exposed, also pre-exposure prophylaxis, where mainly this is for people who are sexually active and engaged with more than one partner, and there is anticipation that you might be exposed in the near future or in your usual day-to-day sexual encounters, or exposure from different situations, not necessarily only sexual, not necessarily through sexual intercourse. But the most important is to visit a health worker, to visit health facilities, because these are the facilities that provide the credible information, but those are the ones you can hold, you can hold true to the information. What we share here, whereas we have professionals, is from research reports, and maybe this may not necessarily be quoted as the real health. However, we are giving some guidance, and we always advise each one of you to go to a health professional for specific diagnosis, but also your circumstances are different. Here we're giving general conversation points and circumstances, but each and every person has different health circumstances that will inform the health provider or the health worker to tailor advice for you, but also to recommend prescription and next course of action. So each and every person is unique in their own way, but this information is supposed to guide us further and help us understand this issue. Now, I want us to go to the last part of our segment of conversation, and prevention. How can we prevent further spread of HIV in the various ways, through mother to child, through sexual intercourse, through exposure from piercings, accidents, name it. So over to you, Prima. How, and you can give this in the 3 minutes, how do we prevent further spread of HIV?
Okay, for the prevention part, well, we shall have so many arms coming in. We shall have the media coming in for sensitization and all that. We shall have communities coming together. We shall have a various sort of teams reducing stigma and all that, but mainly from the basics, from the grassroots, yes. People knowing their HIV status is a very fundamental, is a very key thing in prevention. Reason, if I know my HIV status, maybe let's say I know I'm positive, people are aware, I won't go around, spreading it to other people in humanity sort of view. So that is one measure. The other thing is to IV drug users, prevention or stopping the use of sharing needles, syringes here and there, because that is another form of spread. The other thing we look at is stigma. If we reduce stigma to the people living with HIV and allow them to get the drugs freely, to linkage to care freely, this will slow down this will help us in the prevention of the spread of HIV. We've had so many bodies coming in to prevent this. We have UNAIDS coming in. We have the AIDS information centers spread all over the country coming in. So it's a good thing that whenever you feel like you need some information about HIV prevention, you need linkage to care, that you access these centers. Yes. Thank you. I'm sure there are other measures that I've talked about, but it's a whole big spectrum of bodies coming together and preventing the spread of HIV.
Thank you very much. Thank you very much for that. Yeah, and the different schools of thought when it comes also to prevention, there are conservative ones, there are liberal ones, they are different, you know. So I agree with you that you have given those from your perspective. There is one we grew up knowing, the ABC formula: abstain from sex if you can, you know, and if you're not yet married, please abstain from sex until marriage, you know. But even with marriage, be faithful to your partner. And I know many churches emphasize those two, to be abstain if you can, and exercise that virtue of abstinence. Many are say chastity, be chaste. Then if you cannot, please be faithful. And again, like that is also a bit of chastity, where you're only having sexual intercourse with one person. Again, much reliance on sexual intercourse, because that is one of the leading ways through which HIV is spread. It's not the only one, but it's one of those leading ways. And oftentimes many others happen by accident, like the injections and what people may not necessarily know at times and may not prevent. But those ones of sharing needles, we should also honestly not share needles. Even if you think a person is not infected, is safe, please, that's out of the question. Never share needles for whichever purpose, you know. Not even when you are removing jiggers, please. Never share sharp objects, not even razors when you're cutting your razor blade, you know. When you're cutting your nails. No, that's out of the question, because that exposes you. However, it's known to say that because someone has used the same, they will get infected. Because, I mean, depends also on the time. Many times, if you cut your fingernails with a razor blade and it's a day after or 2 days, it's very unlikely that you'll contract, you know, that disease. But you can also contract tetanus and all other things. So let us just be cautious when using sharp objects, and where possible, not share sharp objects. Yes, the other part of the ABC is use condoms. There are still many debates on this, the safety of condoms. Many schools of thought, even within medical circles, say condoms are not 100% safe. I don't know, Prima, actually, this is where you come in. Please help me with this before we close. Help me with this. How safe are condoms?
So, thank you for that. ABCs had skipped my mind because I was looking at other modes in which you can get HIV, but thank you that you brought it up. Now, about the condoms, yeah, they have a percentage risk. They have a percentage preventive exposure that is not 100%. However, it's up to 90 something. I don't remember the figure so well, but I remember it wasn't 100%. I think the other percentage of the risk is owed to the fact that we have accidents like condoms bursting, or there could be sort of a leakage or something, but it wasn't up to 100%.
Okay, we have reached the end of this discussion. Prima, I don't know if you have any final thoughts before we close. The network has also become a challenge. So any thoughts? But yeah, to also agree with you, condoms are about 90 to 95% safe. And it has been said that people who use condoms are 10 to 20% less likely to contract, you know, HIV. And you had, like you had said earlier, many times accidents, you know, happen with condoms. They burst or they slip off, depending on, on the different circumstances. So many times they slip off, but usually they are more safe than a person not having HIV, than a person who has not used them. So if a person cannot abstain, and if a person has more than one partner, and maybe they also don't know the HIV status of their partner, it's better to use a condom. So please, your final remarks, Prima, in 1 minute.
Thank you so much. I want to start with a comment about, on the ABCs, I want to comment about B. Be faithful, you'll be faithful personally, and your partner is not faithful. So you're assuming, yeah, we are okay, but things have happened. You know, HIV, they usually tell us to look at other people as if they are sick. Consider yourself the only safe person. So it takes a lot of trust to be faithful. Okay, no, not a lot of trust, but you're faithful, but a lot of trust to trust the other person for your own health. So that too, you be cautious about it. My final remarks as we close this is that as we commemorate HIV, as we commemorate AIDS Day, I want to send out a message to us all that at least you should know your status by now. Let's start from there. Let that be the starting point, that we know our statuses. There are different centers that you can go to, your nearest health center. There are self-test kits that we didn't talk about, yeah, but they're there. There are self-care kits. You're scared of confidentiality and maybe stigma. Just do self-testing. Just know your status. If we start from there, well, we shall have fought HIV to an extent. By another inch, we are a step ahead to the 0% infections by 2030. Otherwise, thank you for hosting me. It was a good discussion to share. Thank you.
Okay, thank you very much, Prima, for being part of this, and also thank you for being our true north. You know, all the medical questions were going to you, you know, us being from our, not in the medical field. So thank you very much for being part of this. I thank our audience for being part of this show. We believe this show impacts communities. We believe that people who tune in, take off their time and tune in, learn a thing or two, but also if there is a lot you have to add to this conversation, please add something in the comment section below. Share conversation. We shall be sure to read your comments and share them. We can end infections. We can end actually the pandemic that HIV/AIDS is, or the endemic that HIV/AIDS is. By 2030, we can have 0 infections by 2030 if we follow all these that are being taught to us by professionals, if we take it upon ourselves also as people to ensure that we know our status, so that we prevent the new infections. But also we should end stigma. A person who has HIV is also entitled to love. A person with HIV/AIDS is entitled to respect of their dignity. They're entitled to also sexual, partnership. They are entitled to everything that any other person who does not have HIV is entitled to. The only thing is that many times safely, so that there is no exposure to another person, but also responsibly. But that doesn't mean that we stigmatize or we discriminate. HIV is not a communicable disease. Sitting next to someone with HIV does not mean you're going to have HIV, or even sharing cups, sharing words. I think even kissing is not among those that where you can easily get infected and all that. So it is normal for a person to have HIV, and it shouldn't be a bar for them to access any social amenities or to engage like other people engage. We call upon government to actually outlaw those laws that criminalize someone having HIV or criminalize being HIV positive. Thank you. And I wish you from us here, thank you to Center for Constitutional Governance, thank you to Civic Space TV, and we wish you a lovely week ahead.